The following question was asked by Dr. Gada, who wants to know whether the scratch collapse test or sensory collapse test can replace Tinel Sign and Phalen's maneuver to diagnose carpal tunnel syndrome. I think the scratch collapse test or the sensory collapse test is a very useful test that requires a little bit of habit. You need to learn how to use it, much like you've learned how to use the other tests. And I think it's a great adjunct to the toolbox we have to diagnose nerve entrapments, but I don't think it's meant to replace anything. I think it's just additional skills that we have to diagnose where the entrapment is, to locate it. And I like to add the cold spray test to the scratch collapse test, because it basically numbs the skin over the area of the suspected entrapment. So initially you get a positive scratch collapse test, then you use the cold spray, and the scratch collapse test becomes negative. Then you warm the skin just by rubbing it. You warm it up like that, and then you perform the scratch collapse test again, and once again it's positive. So I think it's just a great way to confirm where the issue is, and I think it also very much helps convince the patient that there's an issue at this particular location. Thank you.